All right, so I am Dr. Kimberly Smith-Dauterive, and I am honored to be giving you this presentation today. Dr. Rita will be back next week. She's just off building Wakana, and I am truly honored to be able to give you this presentation. We're going to talk about hypertension and how we can implement CBD as a potential help to prescription medicines or maybe just to lifestyle modifications. So I am going to share my screen with you now. Okay, so we will be talking about hypertension and how CBD can help. I want to start off just simply by saying that I do have some notes here, so in case I keep looking down, I just don't want to get tripped up about it all. But if you think about the heart, you see this beautiful heart here. Everyone knows that the heart is the pump for the body. All the blood that goes through the body has to go through the heart, and the heart will pump it through. So from the heart, the blood is pumped from the left ventricle, which is the last part of the heart that the blood flows through, into a big vessel called the aorta. And when the blood is pumped from the heart into the aorta, if the flow is nice and smooth, you have a normal blood pressure. If that pressure, though, needs to be a little bit higher because the heart is having a bit of an issue getting that blood into that vessel, that is when we start to see some high blood pressure. So this picture here is showing you what the heart will look like normally when the pressure is normal, and what it looks like when there's hypertension. So on the left side, if you kind of follow that smooth arrow, from that lower chamber of the heart, the blood collects there, the heart contracts and smoothly pushes the blood into the aorta. When the blood flows smoothly like that, no high blood pressure, that's a normal tensive person, someone who has normal blood pressure. On the right side, however, you see how when the heart tries to contract and push that blood through, how the arrow becomes squiggly? Well, that is depicting what it appears like for the blood when it's meeting some sort of resistance. And that resistance we're seeing is right here in the aorta. Whenever the heart contracts and tries to push the blood out and it meets that resistance, that's when you will see higher pressure. So just to give you another view of it, think about you yourself trying to push open a door. If you just simply push it open, there's nothing impeding your way, the door will just swing open like nothing. Now, imagine there being something on the opposite side of the door opposing you. And when you try to push the door, you meet some kind of resistance. So instead of maybe using a finger to push the door open, now you need to use your hand or maybe even two hands and more force. The more force you use, that is what it means to have more pressure. And that's when, with the heart, if it's having to use more force to push the blood out, that is what's making your blood pressure a lot higher. And that's where we get hypertension from. So hypertension, high blood pressure, we have two different kinds of high blood pressure. There is primary and secondary. So over here on the right side, you see essential, primary, or idiopathic. All of them mean the same thing. The latest and greatest words that the American College of Cardiology is using is primary hypertension. Believe it or not, this is what we see in 90 to 95% of our population. Most people have primary hypertension. It's crazy because we really don't quite know why it happens. Now, we do know that there are several risk factors that we can find, and that we can pretty much say if you have these risk factors, your chance of having primary hypertension are high. But there's not really a firm reason behind that hypertension happening. But again, 90 to 95% of our population have primary hypertension. The risk factors that we look at are many. It could be age-related, it could be because of obesity, it could be because of family history. The Black race has a higher incidence of having primary hypertension. High sodium intake, if you're taking in too much salt or sodium. excessive alcohol intake as well, and lack of physical activity. All of those risk factors contribute to a person having primary hypertension. Again, 90 to 95% of people have primary hypertension. Secondary causes of hypertension, on the other hand, are actual issues that are going on with the body. Something is happening with your body. Typically, one of the main reasons is going to be medication related. So medicines like birth control pills can cause your pressure to be higher. Anti-inflammatories like ibuprofen and Aleve, steroids can make your pressure higher. Decongestants, medicines that you take for the simple cold, those are things that can make the pressure higher as well. Weight loss products like Adipex, that can make it go up, and stimulants like Adderall and Vyvanse. Other things include recreational drugs like cocaine, methamphetamines, sleep apnea. Sleep apnea is a huge issue when it comes to secondary hypertension. So sleep apnea is still one of those medical issues that is highly, highly underdiagnosed. And even in people who have a diagnosis of sleep apnea, half of them are still not convinced that they need to be using their CPAP machine. And so untreated or undiagnosed sleep apnea can also lead to secondary hypertension, kidney disease as well, and hormone disorders such as thyroid issues, the parathyroid gland, Cushing's disease, issues with the adrenal gland. So here we have our different categories of blood pressure. And some of you might be surprised because, you know, every year there are reevaluations, different protocols are reevaluated, numbers are reevaluated. Well, guess what we learned today? Normal blood pressure now is considered to be a blood pressure less than 120 over 80. Less than 120 over 80. So in order for you to be considered a person who has a normal blood pressure, you should be less than 120 over 80. An elevated blood pressure is considered to be top number, which is our systolic number, between 120 and 129. And the bottom number, the diastolic, is still less than 80. Stage 1 of hypertension, systolic top number is between 130 and 139. Or the diastolic number is between 80 to 89. And it's either or. If you have a blood pressure that is, let's say 115, but the bottom number is 85, that would be stage 1. If you have a top number that's 135 and your bottom number is 60, that's still stage 1 of hypertension. So stage 2 hypertension is a systolic blood pressure of greater than 140 or a diastolic number greater than 90. And hypertensive crisis, that is a number that is systolic higher than 180 and diastolic greater than 120. Anybody with those numbers, and again, either or, if the top number is 180 and the bottom is 70, that is still a hypertensive crisis. People with those kinds of numbers should seek out their primary care doctor or an urgent care or ER doctor immediately. If they are having symptoms, they definitely need to be in the emergency room right away, because hypertensive crisis patients could possibly suffer from heart attacks and strokes right then and there. So they want to be able to just get there and be taken care of right away. If they're not having any symptoms though, you still need to see your primary care doctor, because you either need to be started on medications or your medicines need to be adjusted. So there are exceptions to this rule though. So number one exception is white coat syndrome. So you go to your doctor's office, you've been checking your pressure at home and your numbers are always stone cold normal. Every time you get to your doctor's appointment though, your pressure is high. Well, that's white coat syndrome. And it's not true high blood pressure. It just happens because there are some people no matter how well they know their doctor, because I have people who have known me since I was a little girl who are still just very anxious when they come to the office. And you know, it's a rolling movie. They are coming into the office, they're nervous. What is she gonna find? My pressure's been good at home. I bet you it's going to be high. It's all of these things that are going on in the minds of patients. They're just nervous. They don't like to be at the doctor's office. And that makes their pressure high. However, every time they checked at home, it's been normal. So that's really white coat syndrome. It's not true hypertension. It's only high in the office. And we really want to treat patients based on how their blood pressure is in their normal environment. So home numbers are of much more worth than what we get in the office. Another exception is masked hypertension, like a mask. And with mask hypertension, the blood pressure in the office is actually going to be very good, stone cold normal. But at home, those pressures are always very high. So let me tell you, this happens a lot for people who they get ready for the doctor's office. So they know their appointment is coming up. They're going to eat better. They're going to not smoke. They're not going to drink. They're going to get a good night's sleep. So when they come in our office, their pressure looks beautiful. But when they go back home, they're eating boudin, crackling, they're drinking, they're just living. And so at home, their blood pressures are always high. Again, this is an exception. So even though that pressure is normal in the office, we want to go by the numbers that the person has in their normal, stable environment. So I always tell my patients, whatever you're doing, I really need to know that. I need to treat you based on what you normally are like at home. There's no reason for me to see a good blood pressure, but your pressure is high at home, because what happens then is you're at a significantly higher risk of having a heart attack or stroke because your numbers most of the time are high. I much prefer for patients to just be honest with me, and I prefer to be able to treat based on what their numbers truly are. Much better for me to have your pressure under control with whatever modes we decide to do. Rather than I think your numbers are good and they're really high and you suffer some kind of horrible consequence. So I just want to just take a moment here to say, please always, always be honest with your physician. This is not about not wanting to take medicines, not needing to take medicines. This is about you having a good quality of life. That's all it's about. Other things that potentially can make your blood pressure higher at the doctor's office: if you smoke or drink caffeine 30 minutes or less before you check your blood pressure, very likely to make your blood pressure go up. If you're not comfortable, if you're seated with your legs crossed, if the blood pressure is not properly taken by the person who is checking the pressure. One of the things that happens, unfortunately, very often, even in my practice, is talking. You cannot get an accurate blood pressure if you are talking to the nurse or if you're talking to the provider while the blood pressure is being taken. So best case scenario is you're quiet. You've come into the doctor's office. You've been given the ability to just kind of sit quietly for at least 5 minutes. And that allows everything to kind of settle. You want to be seated upright. You want to have some type of backrest. The person checking your pressure should have your arm at the same level as your heart. So having the arm just kind of hanging down, you're going to get a falsely elevated number because of gravity. So you want your arm at the same level as your heart, and you will get a more accurate blood pressure reading that way. If for whatever reason you're anxious or stressed, like maybe you drove in and somebody cut you off, that's another reason it might be elevated, and you might need just a little bit more time to calm down so we can get a much more accurate blood pressure reading on you. The last two things I actually was a little bit surprised at. One is it's much better for an automatic device to check the pressure. Evidently, research has shown that when a manual blood pressure is taken, it makes patients more anxious, and it tends to make the blood pressure higher because the patient is just anticipating, you're standing there. So automatic devices give much more accurate blood pressure readings. And if you could use an automatic device and have the staff leave the room and leave the patient alone, that's another way to ensure that the patient is not going to be distracted and want to talk, so you can get more accurate blood pressure readings. So, most people realize we check the blood pressure in the upper arm, but what if you had surgery? What if you have a broken arm? What if you have a dialysis fistula here? Then of course you can use the other arm, but if neither arm is able to be used, you can use the wrist. The thing that you need to remember about the wrist devices is that they are very, very specific in that the probe has to be on the radial artery. So right in here is where your radial artery is. So you have to make sure that the probe is there. And again, your wrist should be at the same level as your heart to get the best blood pressure reading. And if you can't use the wrist, then there are cuffs that are big enough to go around your thigh and your calf. So how do we finally actually decide on the blood pressure, whether you have high blood pressure or not? So the first thing is, every person, whether you have a history of high blood pressure or not, you should be checking your blood pressure at home. If you do not have a history of having high blood pressure, you could check every week. If you do have a history of high blood pressure, you should be checking more than once a week, at least 3 or 4 times a week. And you should be keeping your own log at home that you bring to your doctor's appointment every time you go. So based on the numbers you get at home, because remember, again, that is your safe haven. That is the place where you're going to be the most relaxed, the most calm, and that is where you're going to get your most accurate blood pressure readings. Based on that reading, if you see that on average your number has been higher than 130/80, that is your cue. I need to get in to see my doctor to see, what I need to do. So this diagram here, it gives the algorithm for deciding on whether or not you're going to start medication or just lifestyle modifications. And to be perfectly honest, most medical issues that people encounter, the number one treatment is always going to be lifestyle modifications, no matter what. You need to diet, you need to exercise, you need to change the way you're eating, you need to cut down on the sodium that you're taking in. Sodium is a big, big factor. One of the things that people don't realize is sodium is not just salt. Yes, salt has a ton of sodium, and even when you think about sea salt and all the different types of salt that patients are coming in now to tell me about, all of these salts are still going to pretty much have a high content of sodium. You need to find seasonings that are low sodium. And I am not a fan of the combination seasonings, because think about it. When you season foods using something like Tony Chachere, Zatarans, over here we have something called Slap Your Mama. When you use those forms of seasoning, you're seasoning based on the pepper. You're looking at the color of the pepper. Nobody is paying attention to the sodium. So 9 times out of 10, when you use those combination seasonings, you're highly, highly likely to overdo it with the sodium. So I am a much bigger fan of using salt, pepper, paprika, whatever other, I'm not a cook, so whatever other spices you want to use. But I like the individual seasonings, because you can then truly see how much salt you are using. But you don't get salt just there. You also get salt in pretty much everything that you can readily eat, processed foods. Patients who like to eat out a lot, most restaurants that are in a chain, some kind of franchise, if you Google nutritional facts for and put in the name, it'll pull up the menu and it will give you the sodium content for each menu item. And what I mean is, if you put in nutritional facts for Popeyes, nutritional facts for Chili's, nutritional facts for Ruth's Chris, if it's a chain, then the nutritional facts should be easily found on Google. The problem is going to come in for people who do a lot of plate lunches. If you eat a lot of plate lunches, it's difficult to figure out how much sodium is in there, but I can guarantee you one thing: if it's a good plate lunch, it's going to be loaded with sodium. So you really need to pick and choose wisely when you want to eat out that way. If it's a chain company, then you can look at the menu and figure out which items have low sodium and which ones do not. And most restaurants do have low sodium options. You just have to ask for it. So you want to, based on what your pressure is, you're going to go into the doctor's office. If you notice at your own home, your numbers have been a little bit higher. Again, if your numbers at the doctor's office are still under 130 over 80, lifestyle modifications are going to be first. Exercise, diet, low sodium diet. If you drink a lot, okay, we want to cut back. I'm not going to say stop drinking, but we want to cut back. If you smoke, we do want to really strongly advise that you stop smoking, because not only does smoke increase your blood pressure, but smoke significantly accelerates blockage formation in all your blood vessels. It can lead to heart attacks and strokes. And it's just something that, you know, if we can get rid of that vice, we just want to get rid of the vice. But we want to cut down on those things that are not good. And we want to exercise. 30 minutes of exercise, 3 days a week is all you need. And when I say exercise, walking is enough. If you can't walk, you can go on YouTube and find tons of seated exercises. If you can walk, but you don't live in a very good neighborhood, or you don't want to go out because it's too hot or too cold, literally, you can walk in your house, up and down your hallway, back and forth for 30 minutes. You do not have to go to the park or the gym. There are many things that you can do at your own home to exercise. You just want to have some type of activity that you're doing consistently for 30 minutes, at least 3 days a week. If you're in stage 1 hypertension, it all depends. If you do not have any other thing going on, we can still do lifestyle modifications first and reassess in 3 to 6 months. But if you have stage 1 hypertension and you have diabetes, or blood work shows that you have a slight decline in your kidney function, then that means right here, right now, we're starting some prescription medicine. If you have a blood pressure that's greater than 140 over 90, then again, we need to reassess. Do you have anything else going on? If you have swelling in your legs, if you have a murmur, if you have anything that indicates that there's some type of end organ damage going on, we can look in the eyes and we can see in the back of the eye, and there's something called nicking that we can look for. And there are blood vessels at the back of the eye. And if it looks as though they're really skinny, then that means there's probably some blockage going on in there. So anything that suggests that the organs are being compromised, you automatically are going to get started on some medicine. Other things, if your blood pressure is 180 over 120, that's an automatic diagnosis of hypertension. And again, if you're over 140 over 90, and actually the newer numbers are, it's 160 over 100 with end organ damage, then you're going to automatically be started on medicine. So we talked about different lifestyle modifications. We talked about being able to cut down on the sodium, weight loss. Diet and exercise is the number one thing we need to do. Sodium intake, we need to keep the sodium intake less than 2,400 milligrams daily. All you have to do is look at the label on every single thing you eat and drink to determine how much sodium is in there. Now, Do not forget to look at the label for things you're drinking. I had a patient one time who actually had a significant increase in his pressure. It was from Gatorade. Every bottle of Gatorade had about 360 milligrams of sodium, and he was drinking like 6 of them a day. He thought giving up soda was a wonderful thing, which it was, but he replaced the soda with Gatorade, which had tons of sodium, and he ended up swelling. Pressure was a lot higher. So there are even some waters like Propel, which has some sodium in it. So everything you eat and drink, everything that has a label, read the label to see how much sodium is in there. 30 minutes of exercise, at least 3 days a week, and cut down on alcohol, please and thank you. And if the lifestyle modifications do not work, then we have to consider prescription drugs. So in spite of all that we have, all the information we have, in spite of people seeing their doctors, unfortunately, still half of the hypertensive population are still uncontrolled. And it's a crazy thing to think that, okay, people are seeing the doctor, they have medicine to take, and they're still uncontrolled. Well, yeah, because people don't like to take medicine. They don't like to see the doctor. There's so many things that go on in society that baffles me, because people are afraid of medicine, and by right, some people have a right to be afraid, especially when you see all of these commercials. You start taking a medicine, and a few months down the line, you're seeing, if you have taken such and such a medicine, you need to contact this attorney. Let me say this. I am an internist. So, for most of my patients are going to have high blood pressure and diabetes. If you have a good physician, which everybody should have a good physician, if you do not trust your physician and what your physician is telling you, please find one that you can trust, someone who has your best interest at heart. But every medicine, prescription-wise, that you take probably is going to come with some set of side effects. If you are doing right and seeing your doctor regularly, the whole point of those regular visits is to follow up, to see if there's anything new going on. Are you having any side effects? And to do blood work to see, is that medication affecting your kidney or your liver? And if it is, if you're following up regularly, those are things that are easily reversible. You do not have to go into kidney failure from a medicine if you are following up with the doctor regularly. Now, if you don't want to follow up and you only want to see the doctor once a year, I don't know why the doctor just can't give me my 12 refills. The doctor just want to take my money. Well, guess what? Every 3 months when my patients come in, I listen to their heart. Has anything changed? I feel around. Is their belly good? Has their liver enlarged? Do they have any swelling in their legs? If I see or hear anything that's abnormal, that can alert me that, okay, maybe that medicine is not a good fit. This is not about money. This is about making sure that patients have a good quality of life, being treated for the different medical issues that they have going on. So another thing, hypertension. Hypertension is called a silent killer. And it's called that because most people who have high blood pressure initially start off with pressures that are high and they have no clue. And the reason for that is, unless you go from having a very normal pressure to a very high pressure in a short period of time, and when I say short period, I mean a few hours, you're not going to have any symptoms. If you start off today and your pressure is 115/70, next week, 120/75. Next month, you're at 130/80. If you slowly go up, it's very, very possible to get to very high numbers and you not feel one thing at all. As your numbers are slowly getting higher and higher and higher, your body acclimates. That is just how God made us. He made it where if you hang around at 160/95 for long enough, your body is going to reset its starting point and say, okay, you know what? 160/95 is going to be the new norm. And so if you're gradually going up, it's possible. Like I had a patient who came in with 220 over 110, something like that. He only came in because he did a physical with his job and he could not work until he got his pressure under control. But he's sitting there. This is a new patient. He had to find a doctor because he had never seen a doctor before. But he's sitting there and I'm explaining all this to him. His pressure is still high in the office. But his argument is, I don't think I need this medicine because I feel fine. Yes, he felt fine right then and there. But I guarantee you, all of these complications that you're looking at right now, he was a second away from having any of those things happen. Thickening of the muscle in the heart attack, stroke, blindness, heart failure, kidney failure. Any of those things could have happened to that guy at any moment had he waited any longer. And even still leaving the office after we checked his pressure a few times and he was still that high, he still questioned, you sure? Are you sure I need the medicine? Again, if your pressure gradually goes up, you will very likely not have any symptoms. That is why it is very important for you to be checking your pressure every, if you're a hypertensive patient, you should be checking a few days a week. If you don't have a history of high blood pressure, you should at least be checking once a week, once every other week, but you should have a regular routine for checking your pressure. And what is a scary fact here is when your pressure is greater than 115 over 70, that is when you actually start to accumulate enough risk for heart disease. 115 over 70, and that's across all age groups. And I know many of you, because we're Americans, everybody probably knows an adolescent or a teen who has a blood pressure higher than 115 over 70. So heart disease has already started for them. It's already started. If in blood vessels that were done on autopsies of adolescents and teens, there were many of them that showed the blood vessel had already started accumulating plaque, even at that young an age. And so in this day and age, we have a lot of kids who are overweight. We have a lot of kids who just have free access to the pantry. And those are things that we need to be thinking about long term. All of this is about having a good quality of life. And so all of these different things that are going on here in the heart all have to do with inflammation. Every single one of these disorders, these are all inflammatory processes. Inflammation happens in the blood vessel. Inflammation causes the blood vessel to become damaged. The more damage the inflammation causes, the more plaque forms. The more plaque forms, the more damage that's caused to the organ. So then that brings us to the role that CBD potentially can play. Because remember, CBD is a very, very, very strong anti-inflammatory. So when you think about CBD and the role that it can play in heart disease, it can play a major, major role. What we do know, we know that CBD is a strong anti-inflammatory. What we also know is that heart attacks, strokes, kidney failure, heart failure, all of these different processes are caused by inflammation. So it goes without saying, if I have something that can stop inflammation and I have something that is caused by inflammation, then the thing that stops the inflammation probably is going to help. So when we think about CBD and heart health, then we have every reason to believe that CBD, when taken regularly, can help reduce inflammation throughout the body, including blood vessels. So what we do know is it's a very strong vasodilator, which means that when CBD binds to the blood vessel, it allows the blood vessel to open up. That's vasodilation. When that blood vessel opens up, that is when, if we go back to that aorta again, when the blood is pumped from the heart into the aorta, if CBD is there binding to the receptor and it opens up that aorta, that is how you get a better blood pressure. You have a reduction in the resistance. The artery itself is opened up a little bit more, and that's how the blood pressure is improved. But you're also helping the heart because the heart doesn't have that resistance to pump against. So when the heart doesn't have that resistance, it's less strenuous. So less of a reason for the heart to have to become enlarged. So it's helping in both of those aspects. So it helps by vasodilating. It helps with the anti-inflammatory processes because again, when you have the inflammation in the blood vessels, that is how plaques form. And if we can stop that inflammatory process, we can halt the progression to worsening plaque formation, which leads to heart attacks and strokes. Now, the problem that we have when it comes to CBD is we do not have enough human studies. In order for us to be able to say beyond the shadow of a doubt, CBD can definitely help with your blood pressure, we would have to have double-blinded studies, which we do not have. But what we have are a few studies that were done with animals that have given us some information. So studies done in animals with CBD and heart issues. And of course, these are, things that were provoked in the animals. We know that in animals who had CBD, their blood vessels were protected when their sugars were very high. So animals who, we're pretty much creating a diabetes type environment within that animal. Diabetes, when the sugars are high, it damages blood vessels, it damages organs. Well, when CBD was on board in these animals, it protected the blood vessels, it protected the organs from the sugar causing that damage. Another thing the CBD did was it protected the heart from damage when heart attacks were provoked. So again, we see that in animals, CBD actually protected the damage that could have occurred to the heart long term in animals who were provoked into having heart attacks. And the last thing is animal studies showed that CBD significantly reduced clotting. And so whenever you're thinking about heart attacks and strokes, usually there is going to be enough damage to the blood vessel that you get clotting that forms until the clot finally blocks that vessel and prevents blood from getting to that organ. CBD in the animal studies did show that the clotting was significantly reduced. So again, protecting the organs. So we see that the anti-inflammatory properties of CBD are showing such significant promise when it comes to inflammatory processes in our bodies. And though we don't have the studies to back anything up from a human standpoint, what I can say reduce inflammation. And you also think about the inflammatory processes that can happen in the body as a result of these high pressures, as a result of even high blood sugar, or just genetic things. You can think along the lines that if CBD is such a strong anti-inflammatory, then it's highly likely that it's protective in our bodies. And it is helping when it comes to plaque. It is helping when it comes to decreasing risk for heart attacks and strokes. And for me, that's a good thing for me. I like that. I can honestly say that this is something that for sure I would want on board because I can see the potential for the health benefits that it can give me in the long run. So when we talk about these CBD products, of course, we have to think about Wakana, because what better products to use than the best products in our nation, probably in our world. The simple fact that Wakana goes the extra mile and makes sure that we have the highest quality of products is enough for me. And the highest quality products, meaning that even the soil is tested and sent to a third-party lab to make sure that it is the best ground, the best soil for the hemp from which we get CBD can be grown so that it is in its best form. Once products are made, they too are sent to a third-party lab where they are tested to ensure we have the purest, the highest quality products that we possibly can have. And that combination ensures or gives me that blessed reassurance that products that I take, products that my family takes, products that my patients take are going to be of great quality, and they're going to be helpful, and I don't have to worry about them having any extra anything in it that could potentially be harmful. So when you're thinking about the CBD products, however, whatever form you're using to get it into the body, it will get into the body. When you're making a decision about which one, there's not a particular one just for if you're trying to see if it's going to lower your blood pressure. There's not a different one if you want to see if it's going to help your pain. CBD is just that, it's CBD. The different forms are determined by your preference. Do you prefer drops, or do you prefer gummies, or do you prefer the vape? But also the onset of action and duration is another thing that differentiates the different products. So we're going to look at the products from a what kind of standpoint. One of the things that we can be assured of is that everybody who needs CBD, and I think everybody needs CBD who's 18 and over, can use these products. So Wakana has both a power line and a pure line. In the United States, all CBD in all 50 states can legally have up to 0.3% THC. And the reason for that is when combined with CBD, that little bit of THC allows for the CBD to work at its strongest properties, which is awesome. However, even though this is legal in all 50 states, that does not mean that your employer is going to accept that. There are still some employers who do not care. So I have patients who their employer says you cannot take Xanax. I don't care if it helps your anxiety or not. They cannot take Adderall. And it's the same thing with THC. So even though CBD is legal in all 50 states and it is legal to have up to 0.3% of THC, you do need to check with your employer to make sure that it is okay. And for anybody who has to do random drug screens, you want to make sure that you stick with only the pure line. The pure line is the line that has 0.0% THC. The power line has up to 0.3%. Now, that does not count when we're talking about topical products. So you'll see when we talk about the pain cream and also the hemp power hair that you can put on the scalp, anything topical that has THC does not show up in the bloodstream. But anything that you're ingesting, the oral drops and the gummies and the seasoning, those can show up if you're using the power products. So what we're going to look at first is our power line. We have the Power Hemp MD, which is the strongest oral tincture we have. It is used for various reasons: chronic pain, severe anxiety, insomnia. When you think about the oral drops, you're going to put 1 to 3 drops to start off with under your tongue. Let it sit there for about a minute, and the blood vessels in the mouth are going to absorb those drops. After about a minute or 2, you can swallow. So once you've done that, in about an hour, you can expect that those oral drops are going to be in your system, and they're going to start working. And they're going to work for about 4 to 6 hours. The power gummies are to be taken, you always start off with a fourth. You can start as small as you possibly can. You can always go up, but remember, you cannot take it back. So start small, and you can increase as you feel the need to increase. But when you think about gummies, when you take gummies, you can expect that they will reach their peak in about 4 hours, and they're going to last about 8 to 12 hours. The next thing here you see is our premium flower, which is the dry hemp that you can roll up and smoke if you want to smoke it. Some people also use it as a dry herb and they'll put it in some foods, but the main use is going to be smoking it. And smokable hemp is actually the quickest way to get CBD into your system. Whenever you're using the smokable hemp, probably within a minute, you can expect for that CBD to be in your system, and it'll last for at least an hour or two. And then the pain cream here. Again, remember, because the pain cream is topical, if you do get random drug tests done, you can still take the pain cream because it will not show up. But when you put the pain cream on any particular part of your body, that hurts. And that, I mean, muscles and joints. I have put it on the skin where shingles was. And the shingles, you know, when people get shingles, they tend to have that long-lasting neuropathic pain that they seldom can get rid of. I have even put the cream on the shingles area and had people have resolution of their pain. I actually also had somebody to put it on their temple. They had a really bad headache, and I want to say maybe 30 minutes or so later, she realized, hey, my headache is better. But when you put the cream on, you can expect that it's going to start to work in about 5 to 15 minutes. The cream is going to last about 2 hours, 2 to 4 hours, I would say. So whenever you're thinking about chronic issues, and since we talked about hypertension, think about high blood pressure, think about chronic pain, chronic insomnia, anxiety. You want to do something that we call layering, where you're going to use all of the products and each one is going to take effect at a different time and wear off at a different time. So if you're thinking about using it for chronic pain, you can rub the pain cream on. You know it's going to start working in about 5 minutes. You can do the smokable hemp. You know that's going to work in one minute. But that smokable hemp is going to wear off in about an hour. The pain cream is going to wear off in, like I said, a couple of hours. But at that same time, if you also do the oral drops, let it sit under your tongue for about a minute or so, and then eat the gummy. When the pain cream is starting to wear off, that oral drop is kicking in because it's going to kick in an hour and it's going to last about 4 hours. When that oral drop is wearing off, the gummy is now kicking in, and that's going to last about 8 to 12 hours. So when you layer the products, you can get an overall improvement of whatever the symptom is that you're trying to treat or trying to improve with the CBD products. And this has worked time and time again. It works wonderfully well. I use it myself for my sciatic nerve pain, which every day at the end of my work day, I could count on my pain level being at least a 7. Since I started layering, my pain does not get beyond a 2 or a 3. And it is absolutely wonderful, wonderful, wonderful. We also have a great assortment of gummies. So here we're looking at the different lines that Wakana has available. The King of the Jungle is a very, very popular gummy here. It is the libido booster, the stamina booster. It is part of our sexual wellness line. It's called King of the Jungle, but it could also be called Queen of the Jungle because both men and women love this product. Definitely something great for women since there's really not a prescription anything for women who are suffering from loss of libido. But this is a very, very good product for men because when you think about Viagra and the complications men can have from taking Viagra, this is a much better fit because you don't have to worry about the blood pressure dropping too low or the heart beating irregularly or the heart stopping completely as it potentially can do with Viagra. King of the Jungle, it does have some THC in it. So men, you do want to be careful if you have to do drug screens. King of the Jungle might not really be a good option if you have to do the drug screens, but for everyone else, very, very good option for your sexual wellness for both men and women. The Flight Delta 8 is there. It's said to be the cousin of the real deal. The THC is Delta 9. And so we have Delta 8. Again, we're talking about products that are legal in all 50 states. And so Delta 8, the Flight Delta 8 has a structure very, very similar to the real deal. So people who have used the real cannabis, the real THC, and had issues, you might want to stay away from the Delta 8. However, if you've not had any issues with it, then this is a very good option when you think about being creative, mental focus and concentration. I actually use this a lot for my people who need opioid drugs. So it is a very, very, very good option to use instead of opioids. And it has been a hit 100% across the board. And it might seem strange and it might be a little bit unbelievable, but I promise you, I have a patient who broke her arm. She broke her arm all the way up near the shoulder. And Norco, Percocet, none of it was touching her pain, to the point that she was calling me crying every day. So by this point, I don't know what else to do for her. So I actually said, okay, look, send your son. I have a gummy that I want you to try. And so she tried the gummy, and I didn't hear from her for 3 days. I had to call her myself. And when I called her, she said that she felt so much better. She still had pain, but it wasn't that excruciating pain she was originally having. So it took the edge off. It made it more tolerable. And we don't have to worry about addiction. We don't have to worry about overdosing, because where the receptors in the brain are for the respiratory system, where opioids will bind to the respiratory center in the brain and stop you from breathing if you take too much, there are no CBD receptors where the respiratory center is. Now, if you take too much, you might sleep for a long time. You might feel a little confused or a little wacky for a little bit, but you don't have to worry about accidental overdoses with these. The next is the Pure gummy. The Pure, remember, if it says pure or broad spectrum, we are talking about products that have 0.0% THC, safe for everyone to take, 18 and above, and for concentration, for better sleep, to help reduce anxiety. Taking it during the daytime. I actually have a patient who's been faithfully taking this, and she's been able to get off of her Adderall. So wonderful, wonderful uses for all of these products. And once again, we see the Power Gummies, which are good for sleep, inflammation, and sex. Wakana has a wonderful line of culinary products. These are the spices right here, y'all. We have a person in our group, in our organization. He and his wife have been cooking every day almost with the Wakana products, and they love it. My husband has put the garlic fire on eggs, and it tastes absolutely phenomenal. There's also the CBD butter that you can use for your breads, and there's a water-soluble oral drop and a Culinary Plus drop that you can infuse in your foods and your drinks. Wakana also has partnered with Royal Defense to make sure that, especially now during this crazy COVID season, that we are protected in every way. From our bodies to our countertops, we are protected. So first, I want to bring up the First Defense nasal spray, because I have a testimony to tell y'all. I have been wanting to use this, just never had the opportunity. Well, my daughter suffers from horrible allergies, horrible allergies. And so she comes in a couple of days ago and she says, Mom, can I have some prednisone? Because she gets it so bad that we have to give her steroids. Can I get some prednisone? Because my head hurts, my nose is so stopped up and it's hurting. So I'm like, woo, bingo. We can we can use the Royal Defense. She said she had immediate symptom relief. Immediate. I couldn't believe it. So she said she used the spray. Within a few minutes, her her airway was opened up, her headache was better. So I am 100% on board with the First Defense nasal spray. There's also an Essential Defense drop that you can put on your toothbrush for your gums and your teeth. Wakana has produce wash. They have hard surface cleaner. They have sanitizer for your hands. They have done the whole gamut to make sure that you are protected as a person and make sure that the environment around you is also protected. All of these products are alcohol free. 99.9% of the germs and bugs are killed, and it works for up to 24 hours, which means that it's giving Microban a run for its money. But this here is lab certified and it's all natural. We have the Flat Belly Gummy Challenge going on right now. This is one of our newest packages. We have the old and the new together. The Flat Belly Coffee is something that we've been having. CBD combined with Garcinia cambogia and green tea to boost your metabolism, give you energy, burn fat. But we also now have Flat Belly Gummies, which I am so excited because our package should be coming in any day now. And the Flat Belly Gummy actually has more supplements in it that allow for greater energy boost, more fat burning, and a greater boost to your metabolism. We also have in here the bitters, which is our detoxification tea, which allows for a healthy colon, which is very, very necessary because as toxins build up in the colon, it makes it difficult for your metabolism to be where it's supposed to be. It makes it difficult for you to get rid of the toxins and absorb the good nutrients. So we want a healthy colon so that we're able to absorb the good nutrients and have the fat burning and boosting our metabolism that we're looking for healthy weight loss. And if you're interested in the challenge, please join us. It starts August 1st. You see these wonderful prizes you can win. Get with the person who invited you to this meeting so that they can give you some more information about how to get involved with the challenge. Wakana has a whole line of essential oils. Again, high quality, top-notch products. The one that I really want to mention is the black seed oil because it is one of the most phenomenal products that we can have. Black seed oil does almost everything. It's antifungal, anti-mold, antiviral. Using it, taking it, it actually causes an upregulation of beta cells in your pancreas, which allows your body to naturally produce more insulin so it can help diabetics. So these essential oils, everybody in this day and age knows a little about the essential oils, and Wakana has its own line of high quality products for you to purchase. Here are the other smokables. These are the vapes. When I tell you I am 50 years old and 2 or 3 weeks ago, I puffed for the first time in my life, having a very stressful day and listening to colleagues and some of my business partners talking about how it helps tremendously to just kind of calm you down. I couldn't wait to try it, and guess what? It works. It works. It works. You feel the calm. You feel the calm just taking over. So this is definitely one of my go-to now, go-to products, because feeling stressed, feeling anxious about different things going on in life, if it can give you that immediate relief from the stress and anxiety you're feeling, you have to realize that it's also going to help bring your blood pressure down. It's also going to help with all of the other things, like I said, you know, because it's in the body, so it's going to bind to the CBD receptors wherever it's needed, but it can give you that immediate relief that you're looking for. Here's the full sexual wellness line. The King of the Jungle is here, but there's also G-Spot lube, there's a Cherry Bliss lube, there is body butter, and the Glow Naked. Now this Glow Naked, I was sleeping on the Glow Naked. And one of my actually a couple of business partners were telling me they use this on their feet for the rough skin under the feet. It works. I have bought all of the products because I want to try all of them. I have been so very, very happy and fascinated with the results that I've gotten from the things that I've tried already, the cream, the oral tincture, and the gummies, that I have no doubt that the rest of the products are going to work. But every time I try something new and it does something amazing, it just makes me just really, really excited to tell everybody about it. So don't sleep on that Glow Naked. Use it on the rough, dry areas that you're having issues with, and watch how your skin becomes nice and moist and smooth. And lastly, we're talking about healthy hair. So first we have the hemp-powered hair, which you can put on your scalp, rub it in to stimulate the follicles. It promotes healthy hair growth, healthier, longer hair. And the beard and scalp oil, which men can use on their beards for fuller, healthier beards. If you're in this organization already, you know Minister Mooney has a very nice beard. If you're not in the organization, you can go to our Wakana for Life Facebook page and find Minister Mooney to see how great a beard he has. From my perspective, the hemp power hair is absolutely amazing. I've had a lot of stressful things that have gone on in my life, was losing my hair here on the sides, and I have been using that hemp power hair twice a day, every day for the past month or maybe 6 weeks now, and I can see the growth. Actually, so much so that after my, I'm 50, so I get a little gray. I'm sure you can see a little bit of the gray, but I actually told my beautician, I don't think you did my coloring right, because I'm seeing all of these gray hairs too soon. And she said, Dr. Kim, that's new growth. Your hair is growing a whole lot faster than it usually does. So the hemp power hair combined with the SOS hair care system is absolutely amazing. SOS, Save Our Strands. You get the shampoo, conditioner, detangler, and hairstyling cream. And there's that oud body oil again, but healthier hair. My hair sheds less. My hair is fuller. My hair is shinier. I love my hair. I love what these products are doing for my hair. And so you will love them as well. And this is the end of my presentation. And I know we're a little bit over our time here, but I'm gonna stop sharing, and we're gonna open up for any questions. If you can unmute yourselves, or if we can check here in the chat, and if our panelists can unmute themselves and help out here with these questions. Do we have any pressing questions here that haven't been answered? Oh, I have sleep apnea and don't use a CPAP. Oh, please, 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 please. If you hear nothing else, it's easy to treat sleep apnea. That CPAP device is not to stop you from snoring. It is not to help you sleep all night long. That CPAP device is to keep your oxygen from dropping to dangerously low levels and potentially causing you to have a heart attack or stroke while you're sleeping. Untreated sleep apnea is the one disease that, if you know somebody who had sudden death, they probably had sleep apnea. People that you think of that you said, you know what, I just saw them yesterday and they were perfectly fine, and then you hear today they had a massive heart attack or stroke. Very likely, I found that very likely those are people who have had, who have sleep apnea, who were not treated. So use your device. Again, this is not for you to sleep better. It's to keep your oxygen from dropping. Every single time you go to sleep, your oxygen is dropping to dangerously low levels, and that's what the device is for, to keep your levels from going that dangerously low. The role that cannabis plays in blood pressure regulation. I think I answered that question, but just once again, it is a vasodilator. So it's a very strong anti-inflammatory, but it's a vasodilator. So when it binds to the blood vessels, it opens them up. And as it opens the blood vessels up, the heart is no longer pushing against that great resistance. The blood can more easily flow from the heart into that the aorta. The gradual increase in blood pressure is very good information, Dr. Well, thank you. Thank you, Ma Mitchell. What is considered as low blood pressure? How dangerous is low blood pressure? So mainly, you know, there's some people who naturally have a blood pressure where the systolic, the top number is in the 90s. That tends to be people who are on the smaller side. You know, they're more on the skinny side. They have a low BMI. If you have a history of high blood pressure, though, and you're taking medication and you find that your pressure is below 100, the top number, you need to talk to your doctor immediately. That would be too low. That would definitely be too low. Thank you about CBD bosses about the shingles. Yeah, that the cream definitely works for shingles. Definitely. I could not believe it. Layering, absolutely. We need to layer. Yes, I do want a flat, I want a flat belly. I did sign up. I signed up for the belly challenge because of my wonderful team members. So I hope I can do them proud. Thank you. I'm glad y'all enjoyed the presentation. I pray that I was clear. What do you suggest for high blood pressure? Do you mean if you're talking about CBD products, what if your pressure is really high? Let me just put that out there. If you're talking about a blood pressure that is 130 over 80 or lower, then you can do oral tinctures, you can do the gummies, start low and slowly increase. You have to have lifestyle modifications. I don't care what it is that you're deciding to do when it comes to taking something, you need to change the way you live. You need to eat better. You need to decrease the amount of sodium that you're getting in your body. You need regular exercise. So those are things you have to include lifestyle modifications. Now, if you're trying to add CBD products in with that, then, you know, start with the gummies and the oral tincture, but you do need to layer and you need to do that twice a day. The power products, I would say, if you're talking about blood pressure, you can do power products at night and the pure in the morning. Or you can do pure twice a day. And then you can go from there. Can we order, what is the effect of taking CBD when a customer is currently taking hypertension medicine? So if you have someone who is already taking high blood pressure medication and they start CBD, I have to say, please get your doctors involved. Again, if you don't feel comfortable talking to your doctor about CBD, then you need to have a physician that you can talk to. I have an open relationship with all of my patients because it's the only way that I can be an effective physician for them. They have to feel comfortable telling me what's going on. So you need to talk to your doctor. If you don't talk to your doctor and you're just starting the CBD, you need to be checking your pressure every day. And you need to check at different times of the day. So you can either check 3 times a day, or today you check in the morning, tomorrow you check in the afternoon, next day you check in the evening, and you keep that rolling check going on so that you know what your pressure is throughout the day. And if you see that your numbers are dropping, you need to start cutting back on medicine, but you need to do that under the direction of your physician. Let's make sure we get that straight. Under the direction of your physician. So the pure products do not have any THC, so they can safely be taken if you do drug screens. The power products you need to stay away from. Can we order the flat belly gummies? We cannot order flat belly gummies by themselves just yet. And maybe once the challenge is off, and we're doing the challenge, you can maybe be able to order it then. But for now, it only comes in the flat belly pack, along with the coffee and the detox tea. Yeah, Pastor Linwood. Pastor Linwood actually had a testimony, or his wife gave a testimony today that he took the CBD and noticed his blood pressure was very, very good the next day. Like, I want to say maybe 110, 115 over something that good that without his medicine. So you see, that's the reason you have to be checking. Very good products, but you have to check your blood pressure to make sure you're not getting too low. Can the next presentation be CBD and shingles? Oh, sure. If I get another opportunity, sure, you got it. I think that is for 20 years, my top number goes below 100 sometimes. Mom Mitchell, that's too low, Mom Mitchell. Yeah, make sure your doctor also knows that your systolic, that top number is going under 100. We do not want you passing out, because that is what could possibly happen. If your blood pressure is too low, then you run the risk of feeling lightheaded, dizzy. You run the risk of bending over and falling, looking up, getting dizzy and passing out. So please make sure that your doctor understands that your pressure, that top number is going under 100. That is, I personally would say that is too low. And especially if you're someone who is 55 or older, that is definitely too low. That is, it's more dangerous to have that lower pressure than it is good. So Pastor Linwood's pressure was 110 over 66, everybody, just having taken that the CBD gummy the night before. The flat belly pack looks like it's enough for 2 months. There are 2 coffee and 2 packs of the coffee and 2 packs of the gummy, and the detox is something that you do just at the beginning. Yeah, I think Ms. Gia, doctors are, I think we're getting on board now. I have to be honest, I didn't know anything about CBD, honestly, and its health benefits until my patient came in who was already taking it. In fact, February is when I was introduced to CBD, and thank you, Jesus, because as much as we can do natural, I prefer to do natural. And whereas you take CBD, and this is going to be my last thing I'm going to say. Well, I guess I guess it doesn't matter. I think I'm the last person. If y'all have questions, I don't mind answering. When you take CBD, think of it in this fashion. You have at least 10 organs that have receptors for CBD. So regardless of whether I have an oral drop CBD or gummy CBD or seasoning CBD, the CBD gets into my system and it goes looking for those receptors where it's needed, and it will give balance.
Yes.
That is what I love about the CBD. I don't have to worry about, okay, so I have somebody who has pain. So I give them an anti-inflammatory for their pain. So it helps the pain wonderfully well. But she comes back in and she's like, but I've been having some issues, and I feel a little dizzy. Check her blood pressure. Her pressure is high because the anti-inflammatory medicine that helped her pain made her pressure go up. Or I check her blood work, and she's been taking this anti-inflammatory over the counter for so long for her knee pain, and now it's starting to affect her kidney. Well, I don't have to worry about that with the CBD, because when the CBD is in the system, yes, it's going to look for the muscles and joints that need reduction in inflammation, and it's going to help the pain. But it's also looking at the blood vessel, causing vasodilation and making the pressure better. So I'm not worrying about giving you CBD and it helps one thing, but it causes an issue with something else, like I have to do with prescription drugs. So I definitely love that. Okay, yes, mommy. Oh, my Mitchell is 69. Yes, yes, indeed. Honey, okay, yeah, my Mitchell, that 100 for your top number, that's just too low. Mm-mm. Nope, nope, nope. So I would say maybe give them a call and let them know. If you've been experiencing any dizziness, you definitely need to get in touch with them now. And you wanna move slow. No sudden moves, no jumping out of bed, because those are things that, you know, by the time your body catches up, you're already going to be on the floor. So just move slowly. Um, what do you suggest for clients with MS, lupus? Again, so you know, these are all inflammatory processes. These are attacks. MS is attacking the nervous system. I mean, lupus attacks everything. It's an autoimmune disorder that can attack every single organ in your body. But it all goes back to inflammation. These are all inflammatory processes. So for sure, people who have multiple sclerosis and lupus or any other autoimmune disorder, you really, really should be layering. If it's pain associated, rub the pain cream on. You can do that for sure twice a day. If you need to do it in the middle, do it in the middle. But definitely every morning and every evening, you should be using the oral drops and the gummies so that you have kind of around the clock availability of the CBD to help with the inflammatory processes that you have going on. Can you use CBD to help vertigo? So again, like for example, vertigo, most people who have vertigo have some kind of inflammatory issue with their inner ear. Most people actually have vertigo because of fluid in the inner ear. So our balance receptors are in the inner ear. And whenever you have sinus flare up, when the sinuses all in here get to be swollen, the fluid in the inner ear actually drains forward into your sinuses. So if the sinuses are flared up, the fluid can't drain. It just builds and builds and builds. So using the CBD products helps reduce the inflammation. That first defense, I'm telling y'all, my daughter is like the queen of chronic sinusitis. And for her, and look, she's one of those, it kind of helped, maybe. That chick said she had instantaneous relief. And I promise you, if she said it, it's true. She will not hold back, and she would have easily said, I don't know. But no, that first defense nasal spray, it worked for her. So I have no reason to believe it's not gonna work for the rest of y'all if you need it. But yes, I would say pretty much every issue that we have, most medical issues at the very source of it all is from some type of inflammatory process. And so I have every reason to believe that using a CBD product is going to be helpful. Definitely. So, all right, I think I'm at the end of the question. Oh, wait, one Q&A. Do you know anything about the people that grow? I don't understand. Do you know anything about the people that grows and jump plants? Can you see that, Lisa or Dr. Betty? Or
I'm looking for it, Doc. Is it at the bottom?
it's in the Q&A section.
Okay.
I don't quite understand the question.
Not seeing it. Let's see.
I think at the bottom you can see your raise hand Q&A.
Uh-huh.
Or are you in Q&A and you don't see the question?
I don't see Q&A at all.
Oh, okay. I'm sorry.
Or do I? I don't see it either.
No. Okay.
Oh, wait. Up here. Hold on. Wait. Oh, boy. I'm at the dispensary. I'm sorry.
That's why I look like this. Hold on, I did just see Q&A, but where'd it go?
Or check at the top, maybe?
Oh, at the top. Yeah.
Yes.
Okay. Do you know anything about the? Oh my goodness. Wait. There it is. Okay. Do you know anything about the people that grow marinade and jump plants? I don't understand.
I'm sorry. If you're still on the call, would you like to type it in again or put it in the chat? Because I don't quite understand, and I apologize for that. Okay. No. All right, then. If there are no more questions, thank you so much for your time. I pray that I was very clear and didn't say too much. Y'all all have a wonderful evening and get with the person who invited you to this meeting. Get your products, get started in the business, awesome products, awesome, fabulous business. Get yourself connected with that person and they will tell you how to get started. Good night, everyone.
Good night, Doc. Good job.
Thank you, ma'am.